Hello, and welcome to Cross Currents, where ASRA network members get together in conversation to explore the dynamics, disruptions, and discoveries shaping our world. ASRA is an independent initiative home to over 90 network members that aims to mainstream systemic risk assessment in policy and decision making in response to current and future challenges. The series is entirely member-driven, where network members identify the pressing issues in systemic risk and connect with colleagues to explore them more deeply in conversation. The views you hear are those of our participants and don't necessarily reflect ASRA's institutional positions. So I'm Lalitha Sundaram. I'm an assistant research professor at the Centre for Pandemic Risk Management and the Centre for the Study of Existential Risk, both at the University of Cambridge. I'm extremely pleased to be here today and to be joined by Shama Karkal, the Senior Director of SWASTI, the Health Catalyst, and Henry Willis, Associate Director for Biosecurity Research at the RAND Center for AI, Security and Technology. Today, we're going to talk about building global resilience to catastrophic biological incidents in the context of systemic risks to global health security. I'm particularly excited to have this conversation with both of you because I think it's a really lovely demonstration of the added value that a network like ASRA can really offer. Each of us has come to global health security, and maybe we can unpack that term a little in our discussion. We come to the topic from quite different starting points, but it's in the context of systemic risk and specifically as facilitated by the ASRA network that we've actually been able to intersect and have these conversations. So given this, and as a way to ease us into the conversation, I'm going to have each of us speak a little bit to that, to our pathways into this topic. I'll start with my own somewhat circuitous journey. I trained as a bench scientist in pathology many, many years ago, and then moved into research looking at the responsible use of emerging biotechnologies like synthetic biology or engineering biology. And in part, I was looking at how that's been deployed to address challenges of global health and development. And it's through that work that I was really brought into the world of biosecurity and biological threat reduction, which is pretty much most of what I focus on now. And I've done this largely in the context of global catastrophic and existential risk. And in those fields, it's become increasingly clear that what we really need to get to grips with better are the intersections and interactions between the risks, which is why joining ASRA has been so generative in my own thinking about this. Over to you, Shama. What about you?
Thanks very much, Lalitha. So I was a wannabe physician, I think as a teenager, and instead chose to eventually come into public health from a social action, community organizing, and sort of a community development pathway, because I think my early experiences were working with people and realizing that they did actually have capacity and knowledge, but just needed facilitation and sort of other enablement to actually achieve full potential. I worked on various programs. Public health used to be understood from sexual reproductive health and TB, anemia, vaccinations. So a variety of different programs like that over the last 23 years. And then at the intersections of those programs with technology, community institutions, financing, and I want to say over the last 5 years or so, increasingly with networks and movements trying to sort of achieve better health outcomes. So I like to think of myself as having spent about 23 years in public health on these various aspects of trying to improve everyday well-being for people. I'm based in Bangalore in India, and Southeast Asia has sort of been where a large part of my work has been. And I came into ASRA really because of work that emerged during the pandemic. We were really having to look at innovative ways of addressing the variety of issues that were at hand. And I think we really started looking at resilience for vulnerable communities that we'd worked across the country with for decades, but never really looking at resilience that strongly. So I think ASRA's, with ASRA and colleagues here, understanding systemic risks and contributing to interventions, I think the response side of it and looking at innovative ways to respond to the systemic risks is sort of what's brought me to ASRA and kept me here. Over to you, Henry.
Yeah, I think hearing your stories and how you got here is why I love being part of ASRA, because we all, as you said, Lalitha, come from different places. I started with the simple interest of trying to use science to solve problems. And at the time, I was a chemist and then an engineer. And I worked on problems that were closer to what I did, sort of physical systems, transportation, electricity, water, but then got interested in the interaction of those systems with society. And you can think of public health as one of those versions where you have physical systems that move stuff and deliver services, but they interact. And what, of course, we all know is that life is messy. And we actually, as you said, Shama, want to achieve multiple goals, and they don't always agree. And there's a lot of uncertainty. Yeah. And so I entered this looking at how societies face risks. And I entered through biosecurity, but that's it. So sometimes different worlds intermeshed with public health, health service provision, and health security. And ASRA has been a great place to have these discussions because it brings together folks like us and others that think differently about this.
Yeah. I think we've used the word risk several times now. So what is it exactly that we're worried about? The three of us in the context of global health security. So I have to say that I am not actually a huge fan of ranking risks, of saying like, these are the top 5 things that we need to, because I really don't like that. However, what's top of your mind? What are you concerned about? Yeah, we can talk about what is it that's concerning us, maybe that's different now than it used to be.
Do you want me to get started?
Sure, yeah.
So, I mean, I think the first in my life pandemic that we experienced a couple of years ago, I think, and the thought or the very real possibility that we'll be faced with more pandemics, epidemics and outbreaks, seemingly more like, zoonotic based pandemics and vector-borne, given the sort of changes to our planet that we've been making as society, I think that is something that is of real concern. I know that we're experiencing unusual weather everywhere, but I think that's just going to, it's unpredictable what we're going to experience in the years ahead. But I know that for the communities that I work with, whether it's a drought, whether it's heat, whether it's floods, whether it's earthquakes, all of those are sort of real crises that just keeps pushing people back further and further behind from sort of the goals that we want to see achieved. I think those are 2 things that I'm very concerned about. And finally, for me, from a larger sort of something, again, globally, I think that we signed up for is just better quality primary healthcare. And, 40 plus years into sort of promises that we'd made for ourselves, we're still not making much progress when it comes to what we really mean by primary healthcare and how we achieve that for all of our populations across the world. So that's something else that I really feel like we're really at risk of sort of where we're headed, and just focusing on secondary and tertiary care and not enough on what it actually means to have good quality primary healthcare.
Yeah, so I think my day-to-day work, quite a lot of it is in biosecurity, and a huge part of that is looking at the things like the intersections, the convergence between AI and biosecurity, the changes that technology might have on prospects for weaponization. But that's not actually the thing that really keeps me up at night. I think there's a risk there. I think that it's definitely something to pay attention to, but I think it's already talked about quite a lot. I think the deeper systemic risks around health are we sort of pay lip service to them. We talk about planetary health, One Health, but I don't think we're really grappling with it
Yeah.
in in an operational way to actually have these transformational outcomes. And that includes something that I'm pretty terrified about, which is antimicrobial resistance.
Yeah.
And I think that's especially difficult to get a handle on because it is exactly the kind of multi-sector problem that we're very bad at dealing with, where the incentive structures are all over the place and there are conflicting incentives between those sectors. And I think that's just very difficult to handle. And yeah, and the other element of it that makes it difficult is that it's unlikely to be a short, sharp shock. It's likely to be more one of these creeping catastrophes that we're also historically very poor at dealing with. But I think it's exactly that kind of networked problem that, fingers crossed, something like ASRA should equip us to handle a bit better than we have been.
Henry, what do you think?
Well, I actually like your answers better than what I was going to say. I do like that both of you have talked about this kind of underlying, I've heard these underlying problems that everything else is built on at some level.
Yeah.
And that if we, you convinced me a bit that if we fail to get those right, we really fail to fulfill opportunity. But I'll still say what I was going to say, and it has to do like I am a risk analyst, but you can enter risk analysis by looking at what's going to go wrong, or you can think about how can you not achieve the opportunities you're trying to go for, and that's what I'm worried about, is that we will fail to achieve the promise of really transformative advances in our ability to take atoms and turn them into biology and ways to do things that we want to do. And it can hit us in a few ways, right? We can, if we don't invest in the science and the innovation, in the governance so that people trust the science and the innovation, we won't be able to develop new cures, develop new ways of feeding people, these types of things. And that could be tremendous value lost. We could also, like you, Lalitha, said, actually worry about people misusing this. And so, I mean, it could be a scientist, like what happened in the US when a scientist sent anthrax to the US Congress and post office. It could be we're a messy species, we spill things, so it could be a laboratory accident, like what happened in the former Soviet Union, or it could be just people wanting to harm people, like fortunately unsuccessfully Om Shirinkyo had tried to do. So I am worried about misuse. But the third way is that we could fail to really apply this to help all of us. A lot of the discussions about these technologies and about these risks don't include at the same level of engagement all parts of the world or all parts of societies within the world. And so I think those three ways of failing to achieve the promise of engineering biology are things that I worry about.
Yeah, I completely agree with almost everything that you say there, Henry. And I think it's a tricky tightrope to walk, especially on the misuse, because the risks of misuse or accidents or just thoughtless or unpredictable side effects of technology, we know these things happen, but I don't want us to end up in a situation where we're so paralyzed by the relatively small probability that we get things wrong to not even try and get them right. And how do we do that? How do we thread that needle? I think is really interesting. From work in engineering biology, I think that the principles of something called responsible research and innovation can get us quite a lot of the way there. Things like stakeholder engagement, really understanding the socio-technical systems that we're operating with, rather than, as we've seen fail so many times before, the silver bullet parachuted in intervention that is not developed with the community in a context appropriate way. So I feel like this is where perhaps your work, Shama, really comes into its own, to making sure that these things happen in an appropriate way.
Yeah, and it is a struggle, I think, like both of you are, talking about, Lalitha and Henry. One of the things that when we were talking about science and innovation that Henry just mentioned, and I'm going bring it up as an example, right? I think we're always sometimes looking for new things, but sometimes there's need to just go back to the toolkit that we have and look at how we adapt it and layer with it or work with it to actually make it do more. And I know Henry and I have talked about this. I'm going to just bring that up. And it's the wastewater surveillance piece, right? I think during the pandemic, it blew my mind that we'd been using it for polio for 80 years, but we weren't using it enough for sort of doing early warning with COVID, right? And to something that you said, Lalitha, we can do more of it with AMR. But again, who comes together to actually say that, or who needs to be at the table, right, to actually make something like that happen, and then actually get to interventions at multiple levels, right? So I think to the point that Henry was talking about in terms of governance is required. You need to have community, you need to have the right scientists. There's a whole, and I think that's the other piece. This is going to need coordinated effort with networks and with a lot of people, and just making that happen sometimes seem like so much work, and who's up for it, who's going to hold all of that together. But and I don't know, maybe that's sort of where the answers are, but that's also sometimes I feel like where some of the barriers are. Everybody wants to be able to contain the work and say, this is all I can do and this is what I'm going to do. But yeah, I think the reason I enjoy working with sort of these networks and working with local movements of different kinds of actors is because there's just so much creativity there, and we can try and problem solve in different ways versus just sticking with very tight boundaries of where I'm coming from and how we're approaching this within our own organizations. I think networks and layered networks working together provide an opportunity to sort of bridge the many challenges that we have that we need to overcome.
Yeah, can I jump in on that point?
Please, yeah.
Because you've highlighted one of the tensions I find in this work at the intersection of catastrophe and health is that we have so many individual pressing problems we can work on. We've touched a few of them. We talk about polio outbreaks, AMR, disaster, water sanitation issues around disasters, measles, right? You could talk about any of these individually and you can work on them, and you kind of need to focus. But if you don't address them, and we often apply our funding in those to each of those problems.
Yeah.
If you don't address the underlying issues, the governance, the systems around it, you actually fail to make some progress. In the U.S. side, in the area I work, our big problem is the division between emergency management and public health. They're separate communities. They come from very different trainings. We usually split our funding, so there's even competition sometimes between the two. But we know from systemic risk that you're not going to solve those problems working them independently. So that's it.
Yeah. I couldn't agree more.
But we can't paralyze ourselves getting tied up in the complexity also.
Yeah.
I feel like there's got to be a bit of balance though, because I agree with you most of the way. In that I agree that different communities can do a lot more working together, but we need to do that in a way that doesn't flatten or doesn't treat all risk the same. Because, let's face it, the drivers behind a state acquiring biological weapons and then deploying them are very different from the drivers that make an emerging zoonosis go pandemic. So it's all biosecurity, or it's all biological risk, or it's all biological threat, but they're not the same. And I think what we need is the ability to work across the silos as they are, but also the humility, I think, in our communities to say, actually, you know what, it's not my job to fix that, or I'm not adding much to that. And to understand where the spheres don't always have to overlap or not overlap perfectly, and to understand the expertises that already exist and not try to make every solution fix everything.
Mhm.
I'm not sure if
Yeah,
that
because
is,
I mean,
yeah.
absolutely, absolutely. But I think it also requires then, Lalitha, that you, I mean, and when I say you, I mean, I think it's all of us, right? You need visibility of some of the things. And I think
Yeah.
that's where some of our challenge is that we don't know who's around doing what, where. That remains opaque sort of within our own countries, but then also globally. And ideally, I've been thinking about this was a term that one of my colleagues used, and it's like you need sleeper cells in a way, right? Because at the right time, you want to awaken the right things to be able to respond. But that just means that capacity has to be built, work has to be done, and when it's appropriate, you bring them into it. I just don't think we function like that, right? We're
Mm.
either all out there doing everything or just not. And so I think it comes to how do we work, I guess, differently? What are some of the capabilities that are required? And I love the fact that you use the word humility, right? So and I think that's required across. And for me, what's been fascinating is public health, perhaps many other things, but public health is definitely a multidisciplinary sort
Mm.
of space, right? It brings a variety of different capabilities into it. And yet I feel the need for more and for us to sort of work better with transdisciplinary capabilities being brought to play at appropriately sort of in an orchestrated manner, if ever that's possible. But yeah.
Yeah. Well, thank you. Thanks for that. I was going to say that I really loved your use of the word creativity,
Mhm.
because I think that what's clear over the past 12-ish months is that we're going to have to figure out how to do more with less or do things differently with less across the board. And that's just one of the things that's just one of the realities of the world we're living in at the moment. And I wanted to ask you both about that as a driver of global catastrophic biological risk or biological threats, and any other technical, social, environmental, economic drivers that you can think of that you've been observing recently to global health security.
Henry, do you want to come in first?
Yeah, I'll highlight a couple that are driving my work. And again, a lot of my work now is looking at trying to build capabilities to prevent things that we know, catastrophes that we likely know might happen. Yet we're fortunate they don't happen very often. And how do we deal with that when we have so many other problems facing us? I think technology is one of those that we talked about. So like really amazing capabilities coming on that may hopefully help us do great things, but as I said earlier, could help people do bad things. A second, though, is the tension and debate going on between how nations address systemic risk. One thing I saw coming out to COVID is the way different countries reacted. Some looked at the challenges, the shortages, and doubled down and said, we need to be able to take care of ourselves, and went all in on national unilateral solutions to protect themselves. Other countries looked to reinforce global coalitions and global solutions. I'm not saying either way, is the solution, but I see a lot of dynamics right now in between those two, and easily tipping points that could fall us into one way or another when we probably need both. And so I think that's another driver of some of this future systemic risk, is how we organize ourselves to respond.
Yeah, no, I like that point, especially. I mean, I think it's interesting that more recently we seem to be building more walls rather than sort of just working together, right? And to an earlier point that we were making, that it's a very interconnected world, and it's hard anymore to say that I can sort of create a bubble for myself. And I think if there's a way for us to be thinking about, the world is one family, how do we actually collectively work better together to try and get to solving or creating better futures, achieving transformation potential. And I know recently that doesn't sort of seem to be happening, and I think that's really tragic. I think one of the other pieces, at least, I guess it's related to technology, and definitely, it's a sort of a societal piece or trend that I see, and I sometimes wonder is I don't think that we are sort of doing enough when it comes to community capacities, household capacities. It's sort of a more service delivery perspective, I think, for a lot of things that we're working on. And I think there is existing capacity, and it just needs to be facilitated sort of to a point that I mentioned in how I began my journey into public health, but I don't see enough of that, right? And there's the infodemic as a problem that emerged during the pandemic. I think that exists today as well. There's a lot, both from a technology and social point, the way society and technology interact and what we create, that I don't think is getting enough, is understood enough in terms of behaviors and what it leads to. That's something else that I think is interesting. And we mentioned this very briefly, but I think the whole financing and funding for health and how that's happening or not, and what issues get supported or not, I think is another issue that I think adds to sort of the systemic risk that we're talking about when it comes to global health.
Yeah, I think. Go ahead.
Go ahead, Henry.
Well, just I think the financing is this persistent problem. Of course, there's you could always want more, but the kind of the state and its stature of it, I'll flag one thing that just stands out is the significance of the Gates Foundation's position in funding global health work. It's great they are, but what does it mean that this one private foundation, the world is depending so much on this one private foundation?
Yeah, that the dynamics of that. I mean, it can feel quite precarious in a way that's not very comfortable. I wanted to come back to something you were talking about, Shama, about, understanding that we're a global family and how that doesn't always seem to be the case. And I think I've seen this reflected in the multilateral sphere in different ways, in different fora that I've been either participating in or observing. For us, the ones that we're thinking of are, things like the pandemic accords. And for me, the Biological and Toxins Weapons Convention meetings over the past couple of years, and how the character of those has been really shaped by the Russia-Ukraine conflict, but the COVID pandemic and the inequity of vaccine distribution, of accessibility, and all of those things have come together to really make those, along with infodemics. There's a huge amounts of mis and disinformation about the Biological Weapons Convention and about the pandemic accords and topics to do around that. And it's made those discussions really quite fraught in a way that I don't remember them having been before, which is quite dismaying, if I'm honest. But I don't want this to be too negative a conversation, so I'm going to offer up.
We were getting kind of dark there for a while. We were
a little bit, yeah. So I'm gonna offer up a way of thinking about global governance in biosecurity, health security that is not a new concept. It's quite an old concept from the 1990s, but that for me has been reinvigorated through conversations with colleagues, especially I've got to name check her, Dr. Catherine Rhodes, who was the former executive director of the Center for the Study of Existential Risk. And this is the web of prevention, which I find a really attractive concept. It was first articulated in the context of deterrence and disarmament in the mid-1990s-ish. And there it was recognizing that there's no single answer to the problem of biosecurity. You know, the Biological Weapons Convention, as wonderful as it is not going to solve it for us. Instead, what you need is a layered approach of governance. You need a web to handle the problem of biosecurity. And this web can be composed of overlapping and mutually reinforcing governance systems that go all the way from treaties like the Biological Weapons Convention to things like codes of conduct, codes of practice, norms, standards, etc., etc. And I think what's attractive to me about thinking using that lens is that number one, it thinks about governance as a system. And so it makes me wonder, and this is something that with Catherine Rhodes we're hoping to develop, are there approaches from systems theory that we can apply to governance as a system to better understand it, to better understand where we might need to strengthen our systems, where there might be gaps that maybe are due to advances in technology, Henry, for example, or whether there might be tensions, for example, between security and equity, which is quite a frequent tension that emerges. So how do we better grapple with that? And so how do we direct our efforts a little bit? So it's not an answer, but maybe it's a way to think about the problem that is a little bit productive.
That's absolutely, Shama, can I jump in here? I'm just
go ahead, Henry. I have 2 points, but I'm going to make
go ahead with yours, and then
go ahead.
I'll hold my exuberance for
No, not at all. Go ahead. I know we got excited for the right reasons, and I think it'll be interesting how we're going to come to it from very different perspectives again.
Yeah. I can't wait. I can't wait.
It's the thing that excites me here is that, in fact, in this problem, despite what we were just talking about a few minutes ago and getting dark, there are so many things we can do. There actually are solutions, and there's different ways, coming up from different the web of prevention. The framing I come is managing technology-induced risk, and you can talk about removing the conditions that create the exposure. You can talk about modifying how the technology interacts with humans and society to change the risk. You can talk about reducing the risk when it comes, and you can also help us recover after the fact. And there's opportunities all along that web. So there's responsible scientists, whether it's on the back end, the opportunity to invest globally in pandemic preparedness and sort of everything in between. Our work has been on how do you get those tools, identify those tools, specify them so people can apply them. So we have biosurveillance, maybe we can talk about that a little bit more, or other types of just preparing civil society for catastrophe, including the ones we're talking about.
Yeah. Yeah, no, and I loved the web, because I think it's just a sort of a brilliant way for many things that we've talked about already, right? Networks and layers, and I think different things that need to come together. And I think prevention, within the public health world, it is a big thing. I mean, we talk about prevention for many things. So I'm just glad to hear that it come together in that way. And I think especially in the context of, people and resilience, we've always talked about the fact that you need various kinds of web. So the next piece to me that is interesting here is that we're talking about governance, right? And then saying governance is a system and applying systems theory to that. It's something, because again, when I'm working with institutions and institution capacities, whether we're talking about sort of community institutions or governments or other kinds of institutions, and I think it'll be fascinating to see what governance looks like in different contexts, cultures, institutional aspects, and what emerges. But yeah, that's something that we should continue to talk about, Lalitha, even after this.
Absolutely, yeah. I'm really excited to delve into that in how to get these various institutions and actors to work together, because I think that's something that we've also identified as a difficulty, as a challenge, is whose job is it to perform these functions? Where does the responsibility lie? Who's the duty holder for many of these systemic risks? In this conversation, biological, but really it applies to all of ASRA's level of interest. So
Yeah.
things like interdepartmental,
Interministerial, etc., right? Yeah.
yeah. So I think that's
Absolutely.
And isn't the answer to that who's the duty holder? You can look at that at multiple levels. You can look at it at the global level, and you can think about
oh
global.
yeah.
You can look at it at the national level and look at health departments or security organizations. You also look at it at the dinner table level. Like how does the individual decide when they see that flu season is high that they're going to maybe get a vaccine or wear a mask on public transportation.
Mm-hmm. Mm-hmm.
Yeah.
And so that you have to address these global
Absolutely.
catastrophes at each of the levels.
For sure. And I think and for me it's been sort of a personal journey as well over the last couple of years is to say from not just looking at public health programs and working with actors, but now looking at it through sort of networks and collaboratives and looking at this from network effects. What is the multiplier effect? Because you want this, things that are working, and there are many things that are working, but how do we get it done at scale together with the different actors, right? And that's a sort of a journey that I'm making with the work that I'm doing as well. So I think it's fascinating that we're having the timing of this conversation, I think is really, really interesting to me. So yeah.
I think what you said also sparked something else in me. So having said earlier in this conversation that not all biosecurity challenges are the same, they oughtn't be treated as though they are. The more we talk, the more connections I'm finding because there's again another really quite foundational concept in disarmament biosecurity that talks about the biological weapons problem from the individual to the international, and exactly talking about the different layers at which different actions can be taken. And that's work that was done by Jez Littlewood initially. And I think this goes right to what we're talking about, both the breadth of actions that can be taken, but also the different depths at which that action can be taken. And I think that can also be really quite empowering to see that there are roles to be played at those different loci.
Do any of you go ahead?
Sorry, Henry. I was just saying it sort of also looks like then, at least I'm trying to visualize this, and it's like multiple webs of prevention.
Yes, it could very well be. Yeah. Yeah.
So yeah, back to you, Henry. Sorry.
Well, we've been agreeing so much. I want to try to ask a question that could maybe sow a little bit of tension for growth purposes. One of the things I find, I was an engineer, I entered into public health conversations, and one of the things I find is this universal, all public health is good, so we should invest everywhere. Do any of you see areas where you see waste? That, we actually should be doing less of this and more of this, or this is counterproductive?
That's a hard one.
I mean, I can see, I do worry, so I'll go back to wastewater surveillance at some level. I do worry that some of these approaches get a bit glorified in ways that they become trendy and say, well, let's go and get money for this, and they apply it everywhere. And sure, there's some goodness and we can learn and we can transfer. But we miss the fact that there are local contexts where there is a pressing need and where these technologies are differentially valuable versus redundant. And so I do think we risk peanut butter spreading our funding too much and not being able to target it at where it can be most effective. And I see missed opportunities in wastewater surveillance and kind of too broad in other areas.
Yeah, I'm gonna take that a little bit and run with it and maybe broaden it, not just wastewater surveillance, but biosurveillance, genomic biosurveillance in general.
Yeah.
I think it's really skyrocketed in popularity and in many ways for good reason. During COVID, we saw that, it gave us a lot in terms of understanding viral evolution, et cetera, et cetera. But in other ways, it really fell short. And that was not necessarily because of technical reasons or technological reasons. It was because largely infrastructure, data sharing, data quality, things that are very much to do with local capability, local context, that are not, it can't just be a one size fits all solution. It's not, we saw that it doesn't work that way. So for me, I think that for something like biosurveillance to really work, it's got to be situated within a well-defined framework that is pragmatic, that is real world, and that ensures that the data that we collect actually does support decision making in effective ways. And so that means clarity on scope, on risk profiles or risk prioritizations, like what is it for, and on governance. And I also think that it's only really going to make sense if biosurveillance systems are valuable outside of crisis as well as during crises. It's got to have, I don't like this word, but the concept is it's got to have a peacetime dividend as well as a utility during an emergency. So I think that's more or less similar to what you were saying. I think some clarity on like what is it that we're trying to do, what is it for, and are the frameworks and institutional setups able to support that are crucial to ensure that the money that we do spend on interventions is not wasted.
And I mean, I think it goes back to a point we were discussing earlier, right? Is governance, decision making, and I think given that there are a whole range of tools, it is often a question of, like you said, Lalitha. I think the scope. What do we want to achieve? Why? What's cost effective? And I think sometimes we're not discussing these things enough with the right people. Or repeatedly, right? It's a decision that's once made and sort of stays in place, but you need to come back to revisit some of these decisions. So, and I mean, and that's my, sort of, we do need to invest in science and technology and innovation, but sometimes old tools, frameworks, etc., can be just adapted and deployed better and can be cost effective as well. So knowing when to do what for what reason, I think is where governance and some of that sense making and decision making capabilities. I think that's something that we just need to invest in more when we're talking about areas for investment as well. Right? So.
Yeah, trying to guard against being attracted by the shiny thing and actually spending a little bit more time thoughtfully considering what's needed. What do we already have? I mean, it sounds so obvious when you say it like that, though.
But yeah.
Hmm.
And so I think, sometimes we like, in our part of the world, it's like there's an innovation challenge all the time. We're always trying to find the next new thing, the big thing. And some of us, like innovation's also just doing something really well with something that's already existed. So I think even just how we use the word innovation sometimes can be useful to just reframe and say, hey, innovation's not just the next new shiny thing. So.
Yeah, actually, it's funny because I've been having very similar conversations with biosecurity disarmament folks, but on the flip side, thinking about risk, it's not always the emerging technologies that are the riskiest. Sometimes the very, very oldest technologies are the ones we should be really scared of. So
Yeah, sure,
the
absolutely. Yeah.
novelty as promise or the novelty
Or
as peril
yes.
is a little bit myopic to thinking in our thinking.
Yeah, for sure, for sure. One of the things that we started talking about earlier when we were talking, I think it was, to me at least, and I'm going back to something that Henry said right at the beginning, which was about trust. And then a little bit later, you talked about humility, Lalitha. And I think I'm just thinking about, we're talking about capabilities and risks. And so I was like, sometimes those are, I think, at least I was thinking about barriers to a more unified response or a systemic response. And I feel like those are things that come in the way of, get in the way of actually looking at a systemic response, right? So, but yeah,
that is very foundational. in fact, I was just having conversations with some colleagues that if we really want to make better decisions on reducing these health security risks, we need trusted information. But that means some of that I see as very scientific, like how effective is this? Where should I put it? Like some great like answers that people can dig in and provide. And that's a lot of our work is trying to do that. But
yeah,
if you look at our responses in COVID, like as individuals, who do we trust to tell us?
Yeah.
Right. And then if you scale that up, I mean, imagine during COVID, if we had a system that was giving accurate, reliable, valid information, and that when it was being reported, everyone understood that's actually what it is. And we could see that where COVID was at all times, particularly very early. Think of how the responses would have changed about travel and about that. We might have had a very different response if we had that information, and the capability is there to do it if we can solve the trust problem.
Mm-hmm. Yeah. And to a point that, when we were talking about the web of prevention, Henry, you were talking about preparedness. And I think if we were to look at right now as peacetime, but, that's where we would need to invest again, is in building that trust, building those mechanisms for, sort of referring to the sleeper cells that we were talking about earlier, that's again foundational. That's work that needs to be done now, so that when a problem arises or we're responding to a problem, we can do it better. And that's at all levels, right? It's individuals and households with their own community, and take that to, a province or a district and a state and countries, and then between countries. And that's a huge amount of work to be done. So, yeah.
Well, I'm gonna take a pessimist hat and say, but I'm gonna ask each of you, like, so maybe no one's ever gonna trust anyone. It's kind of persistent. We always are skeptical of the other viewpoint that doesn't. But in each of your worlds, I'm curious where you see a path towards building trust. So in bioweapons that you've been talking a lot about, Lalitha, verification has been and accountability has been the weak link.
Yeah.
Can we solve that? Or Shama, in community sourced health solutions, can we create healthy information environments? What's the path? Do you share my pessimistic view, or is there a future here?
I'd like to believe there's a future. I am by nature, I think, optimistic, and I wouldn't be here doing what I do if I didn't think there was a pathway. There is a pathway, and that more need to be built. I actually do believe that. I think and to me, trust is earned and trust is sort of maintained. And earned trust comes, at least in a community and a collaborator context, is by that the behavior being reinforced, repeatable. You can actually rely on something, and we do see that happen, right? Just from our experiences and from even the networks that I work with. Civil society and community relationships are built over time and reinforced because there is a give and take, and there's a reliability to that, and that's maintained over time. And it's not always dependent on a financial transaction. And I think that is a sort of elements of that. But it is intense work. So I'm not saying that is the easiest thing to do, but I think it's you have to earn it, and then it has to be maintained. And what today we're actually looking at that even digitally, right? Saying that how do you actually create and maintain those relationships of trust through a variety of sort of digital technologies, whether that's just smartphone-based, phone-based, et cetera, because the pandemic also told us that you couldn't always meet people. So you can't just build relationships of trust that are based on FaceTime. And so how do you actually do that? And then having a combination of that. And that's part of sort of the journey that we're trying to make now, in saying that how do we work with networks and communities at scale digitally and otherwise, on the basis of trust and of give and take, and showing that it can be done in crisis, in peacetime, and other times, and you're not just a beneficiary, you're a contributor as well, and you can support others. So it's sort of, can we create those upward spirals? And I am a believer that we can, and that we should continue to persist with that. So yeah. Over to you, Lalitha.
Yeah. So coming at it from a different level, from a different perspective, I think you're asking about trust between states, for example, in the context of,
that's the nice about this conversation. We can look at this trust at
at so many different
the living room level, or at the the security conference.
Exactly, yeah. So speaking specifically to something like the Biological Weapons Convention and the verification regime within that, I said earlier that I think that the character of it is not always that optimistic these days. But even so, there is progress being made. And I think what we've got to get away from is the idea that we're going to have some big shiny verification regime that's negotiated in a month, and it's going to be there and it's going to change the face of biosecurity forever. I think the reality of it is going to look, well, it does look, and it's going to continue looking a little bit less sexy, frankly, a little bit more incremental, a little bit more quiet and expert in character of what does it actually look like when you're on the ground and trying to verify X, Y, or Z? How do you build up a picture of whether someone is within compliance or not? And how do you, what are the pieces of data and pieces of information that you need in order to build that holistic picture? I don't think that we're ever going to get a yay or nay. Yes, you can trust the state, or no, you can never trust the state decision on verification. So I think the sooner we can jettison that fantasy, the better off we'll be to moving somewhere pragmatic. I would also say that as dismaying as the geopolitical situation may look at the moment, we've arguably been in worse. And I mean, which is not to downplay the things that are happening now at all. And also not to say everything will be fine, let's not worry. I'm not saying that. But what I'm saying is we've gotten out of tight spots.
Ourselves out of,
yeah.
Yeah.
So it's not impossible to negotiate, even when things look pretty bad.
So now I'm going to posit something, and you may disagree with me, but I actually think, going back to what has driven me, science to solve problems, I think technology actually can give us tools to solve this, right? In a silly example, in the US, we have these talk shows where a man comes and doesn't trust the woman that this kid is their own, and they do a genetic test and they say, oh, it has to be, it is your kid, right? But, building on that, I think engineering biology could create, I see the world in the future where you can say, hey, this outbreak of unknown origin, this was a laboratory leak, and this probably came from this part of the world. Or, hey, there's this new disease circulating, but we know that this therapeutic, if administered, will treat it, and we have confidence it won't have side effects, not because we've tested it, but because we can engineer the biology.
Yeah.
I think so it could create, there's the potential, it's so transformative, that it could create tools that we could trust the tools because we understand them so well.
Yeah, I think that there's a very real chance of that happening in the not too distant future. I think what will persist is the question mark around dual use technologies when things have not yet happened. So that's where the verification challenge came up, 20 odd years ago, is if a state has a plant that is producing vaccines, how do you know that that's all they're producing? How can you engender trust in that? Which I think is a slightly different problem. And I think that has much more to do with international relations rather than just technology, although I think that there are ways technologies can help us there as well.
Yeah, so I'm not saying we have to be myopic on technology, but I
No.
There's opportunities to invest that could help. If mothers can say, yeah, I see why I can trust this this medicine, or states can see why, hey, I can see why this will be effective, or why I know where that came from.
Yeah,
Yeah.
for sure.
Yeah. But it's been really nice to hear
Fun.
it's fun, yeah, to hear the different views here. And I
Do
guess
you
I'm
have a
not
closing thought, Henry?
well, I'm not confident that we have solved these. Like, I think each of us have seen, each of us shared very systemic challenges and barriers to
No kidding.
reducing these
Yeah.
risks. But I did a report a couple years ago assessing 6 ways that national level or global level catastrophe could emerge. And people would say, well, how can you wake up thinking about that? And the answer was, actually, there are things to do about all of them. And I think I've heard that here as well.
Yeah.
Yeah. And I, work at the Center for the Study of Existential Risk, and people ask me very similarly, how do you keep a smile on your face? And it is because we're able to have conversations with like-minded folks who bring like-minded, but bringing in diverse expertise that we can build on and that we can turn into action down the line, which is really exciting.
Yeah. Well,
Yeah, and when you work with good people trying to do good things, I think it keeps us going. I know it does for me. So yeah.
Absolutely. Well, on that warm and fuzzy note, it just remains to thank you both so much for
Oh,
joining me in this conversation. It's been a ton of fun. And yes, there will be many more cross currents conversations from ASRA Networks in future. Thanks so much.